This morning's testimony was raw. Real people who wanted to make sure the legislators know the consequences of cuts at health and welfare.
Welcome to this public hearing of the Joint Finance and Appropriations.
Lori Swisher of Idaho Falls has a daughter who's disabled and says if lawmakers think costs are bad now, wait until they eliminate developmental services.
The expenses are going to be enormous. It seems like it's enormous now, but it'll be worse.
And I hate to say it, but Hitler tried this, eliminate the lesser population, and look what that caused us.
Bruce Boren also made the trip from Idaho Falls and felt the need to be here today to show support for health and welfare programs that provides financial assistance to families with members with disabilities. His brother is one who benefits.
Without those programs, he doesn't have any social interaction other than our immediate neighborhood. And he's a social butterfly. He'll go out and visit with everybody when he's see how they're doing. He keeps me up on the neighborhood news, the whole thing.
Swisher says the money health and welfare uses to fund programs that treat developmental disabilities is already put to good use, something she has firsthand knowledge.
I have a daughter that is disabled, and she has benefited amazingly from these programs.
But not everyone who testified are just parents. Some are also providers, like Janet Boyce of the Southeastern Idaho Developmental Center in Pocatello.
And I can tell you that the 50 people I serve, many of them will be without places to live. They'll be without the supports that keep them in their homes, that keep them in their jobs. And that scares me. And I'm also worried about my own employment. I'd be out of a job, and now's not the time to be unemployed.
Janet was one of those who testified before JFAC.
And I hope that they can also understand that a person doesn't stop needing supported services simply because they turn the magical age of 18, that the needs continue on into adulthood.
Scott Burpee is also a provider, CEO of Safe Haven in Pocatello.
First off, I'd like to point out that the Idaho Medicaid providers this last year have been to a very rough time.
Burpee reminded lawmakers how companies like his suffered delayed Medicaid payments.
Many providers are facing imminent closure or bankruptcy.
But while JFAC heard emotional testimony, they also got a healthy dose of suggestions.
Is to enforce the rules that are already in place.
Current Medicaid dollars treat the symptom and not the cause.
More than one dental worker like Rich Bailey says the state could save money through programs that focus on prevention. Others went so far as to ask lawmakers to look at other means of funding health and welfare.
Passed legislation to increase taxes on beer, wine, cigarettes, repeal the grocery tax credit, and collect sales tax on internet sales.
And even though today's hearing is now over, you can still comment before JFAC by sending them an email to that address you see listed on the lower half of the screen. And just a quick reminder that it will become a part of public record. Back to you.